I am I am singing your praises, Dr. Abbasi, because it was maybe 3 weeks ago I turned the corner and I mean, my foot's still kind of screwy, but I really feel almost back to normal.
And your story, actually, the picture you sent me truly made my day because, I think one of the things that I tell my patient um, is that uh, as a professional, we like to see that what we do has a meaning. And you standing there with your daughter in that horse show with a smile, that gives my work a meaning, truly a meaning. It's not
Well,
just putting a piece of machine together. It's not our my job as a surgeon is very mechanical, but that smile, that picture gave my uh, mechanical expertise a true meaning in what I do.
yeah.
But
I can't even describe to you because I would say, I mean, there's a couple different things. One is the difference in how you treat people, because I've seen a lot of doctors and I did a lot of, snooping around and research before I called. And when I called your office, I have to say, I'm not, the Riverview people are different, but boy, your staff in Alexandria, you can't pay those ladies enough because I called cold. They had no clue, who I was or what was wrong with me. And they were the most compassionate people I talked to during this whole ordeal. So anything that I can do to let people know that, I would be
thank
glad
you,
to.
thank you.
I,
But
I,
as well, let me give you some credit because you're a lawyer, you're well researched, you did a good research on what you are getting, you know, and a younger version of me would be say, oh my God, a lawyer coming to my practice. What am I going to say? What am I going to do? How am I going to talk? Now she's going to keep me responsible for every little half sentence coming out of my mouth. But a more versed and experienced version of me say, this is the best patient to deal with because the informed patient is the easiest patient to communicate, tell them, what are you looking for? What do I have? Where are the coverage of, some people, who don't haven't done research, don't know about their disease. And as a patient, this is not what you do. You're a well-educated person, but this is not what you went to school for. All of that is new to you, but you have the tools these days with internet and so on to go and learn about your condition. But you need still somebody to help you, to guide you, put the information, make them click, and make you understand that. And in your case, because you did your own research, you have very well educated before even you came to us, you made my life so much easier to communicate those information to you. And
well,
that
I,
is,
I don't know. I said to my partner the other day that, and now I'm not saying this to like feed your ego or anything,
yeah.
but I did tell him the other day that I thought you were a genius because
Oh, thank you.
I still cannot comprehend how all that apparatus is in my back and making me feel good without a large incision and a lot of, other damage. So I appreciate you saying that you think I'm educated, but I can't comprehend it. It's unbelievable to me.
And
So
neither can I comprehend that you read a legal text and you just understand everything. When I read a legal text, I just throw my hands in the air and say, what does that mean in English? You say, no, it is English. No, what does that mean in English? I think people need to understand, when you take a flight from Fargo to New York or wherever, uh, 10,000 things has to go right. And that pilot, that the engine, that the mechanic, that tower, they have to work in such a harmony. And each of those people are so at the highest level of education, like tens of thousands of hours of flight and so on. Everything goes smoothly, but I'm a private pilot. I know how many things has to go right before you can just sit in that airplane and enjoy that. So what I do is not unique to Hamid Abbasi. And thank you for thinking I'm a genius, but I think you're a genius that you understand those legal terms so easily. But I think it's a process that, that the new process, everything we do now, if you would take that just 20, 30 years ago, is science fiction. Everything we do today in medicine, like I open up your entire spine, put it together, or take a tumor out of your brain, just 30 years ago, many of those things would have not been possible. In the spine, we are lacking 25 to 30 years behind the other areas of minimal invasive. But before we come to that, why don't you tell me your story? When did you start having problems? Tell me about how your life was before we started all of this.
I'm almost 65 years old, and until my back was a problem, I had 2 surgeries in my entire life. One was a C-section when my daughter was born, and one was an appendectomy. So I've never had any hospitalizations. I think when I had a C-section, I talked the doctor into letting me go home the next morning. But so I have bad joints. My knees are bad and my shoulders are bad. I have a friend, again, who's an orthopedic guy in Fargo. So he'd been injecting me off and on when my knees and shoulders got bad. But then I was sitting at Valley Bone and Joint in Grand Forks because my shoulder was just driving me crazy at work, and I went in to get injected. And I happened to say, and this guy's not even an orthopod, he's a sports medicine guy that they use as an injector. But so I say to him, hey, my back has been feeling kind of weird. And he said, well, why don't we run you in and do an x-ray on your back and see what it looks like? And he came back into the office and said, basically, excuse my language, he said, holy shit, you should be hurting like crazy. Are you telling me this just started hurting? And I said, yeah, it just started symptoms. That was probably February. Maybe January, but yeah, probably February. And he said, go get an MRI. And of course, they have a neuro guy at Valley Bone and Joint. So he referred me to his partner. And I went down and got the MRI. He read it and said, oh my gosh, this is a lot worse and how are you surviving? Because you should be in more pain than you are. So then, of course, I called Mickey Sirkin, who just is a friend, and he explained to me how bad my
neurosurgeon, cancer. Correct? He's a neurosurgeon?
Yeah, he's a neurosurgeon at Ascension Fargo.
And he does himself lots of spine procedures and so on, correct?
Yes, he does. And he does a lot of necks too. But anyway, so I visited with him. He said the same thing. These films look bad. So I started Googling doctors and calling people. Then I started Googling and researching, and I started reading about you. And I thought, why in the world am I going to go down where there's a question of whether they can do it minimally invasive? And I actually, once I called your office, and I wish I remembered her name, because the woman I talked to was so very nice. And I thought, I'm never going to get in with Dr. Abbasi because I don't have a referral and they don't know who the heck I am. So, but she was very accommodating. I just read and looked around but I can tell you probably the entire month of April, I wasn't moving. I would go to work. I worked mostly standing up.
Yeah.
And I got through my court, but then I bet, once they told me that you would get it done at Riverview and they told me to go in and get COVID tested, I think, boy, Dr. Abbasi, I think from the time they tested me until the time my daughter drove me over to Crookston, I don't think I left my house or my couch. I couldn't
Lots of people don't understand. Lots of people who don't have spine problem, they cannot wrap their head around how it is with spinal pain. And I have myself sometimes spinal pain. But why don't you describe how was your usual day? Pain, how bad was it? What activity?
I can tell you from the time I think so. The surgery was the early part of May, I think, wasn't it?
Yeah.
Yeah. I would say from mid-April until you did my surgery, I wasn't functioning. I really wasn't. I was going to work as much as I could. Um, but I literally, and I also say I never cry. I mean, I really don't have a recollection of crying because of pain before. And I was laying on my couch crying. I, I mean, I was having, I can't even describe to you because I usually go at a pretty fast pace all day long, both personally and work wise. And
Mhm.
I wasn't doing anything. I was minimally getting my work done. And I mean minimally. I was using COVID as an excuse to not see people, you know,
Yeah.
and I because then I could lay on the couch and talk to clients without having to I mean, getting dressed hurt, taking a shower hurt,
But I
getting
give
in
you
my,
credit, most of people are shut down completely. They just, people get through depression because they cannot do anything. So you still were taking calls on the couch. So my hat up to you. You
well,
told
and
me
I
that
can
when you talked to him, he said, if it works, I want to know about it.
Oh, yep, yep, yeah. And he also gave me a lecture about the likelihood of success of surgery and that even when you do it, there's a chance it's not going to work. But yeah, no, I that is true that and in fact, Eichmann, who's the neuro guy at Valley Bone and Joint here in Grand Forks, um, I
Mhm.
just heard this came from my physical therapist. She said she was really surprised that Eichmann had started referring to you.
Yeah.
Um,
Thanks
she
to you.
must have gotten a PT patient after post surgery or something. But she did say that. She said she was surprised. They're very I don't know, provincial is probably not the right word, but Valley Bone and Joint is very protective of their client or of their patients. They
Absolutely.
don't refer. So yeah, I mean, I have told everybody. In fact, I ran into it's a long, sad story, but my mother had some brain surgery at Sanford and Fargo before she passed away. And I ran into her neurosurgeon and said the same thing. I said, you're not going to believe the great result I've had. So yeah,
Why do you think you had great results? I mean, you did your research, you know what the alternatives are. So what were you expecting from an open old-fashioned surgery, and how
oh,
was your result
I think
different?
what I was expecting if I had had somebody here do it the old-fashioned way is I literally had told my partner I thought I would just have to take a year of leave of absence because I kept hearing it could be 6 months of recovery, and I thought if I was out for 6 months, I'd have to refer my clients to other people, and I kind of figured I would just have to walk away for a year and then try to get back up to speed later. But I also remember, and I'm not sure, I know you told me, I don't know who else told me, but I also had this paranoia about blood loss. I kept hearing when they do the old fashioned cut you open that you lose so much blood. And I also remember hearing, and
What did you hear? How much blood you lose if you do a surgery like that?
I don't know. I honestly
Yes,
don't remember.
scoliosis, you can lose easily a gallon of blood.
Yeah.
Can be. Now, generally after what if you are okay with that, I like to literally show you few things that about your surgery, how what it was, how it was, and what your problem was. Are you okay? You want to see what we were dealing with, and I just bring you, one more time, in the loop about what was the problem and what we really did.
Sure.
So this is, let me share my screen with you. First of all, this is the record of the surgery. In the surgery, we, we did a four-level fusion, L2 to S1, and as a matter of fact, this is your back. This is your
Yeah.
back. We put these four cages in, we put 10 screws, two on each level, five on each side, connect them with a rod. And we put all of that through smaller holes, obviously. And the time we spent on the surgery here this is your record, was 1 hour and 16 minutes. That's all.
And that's crazy to me. I just can't even fathom how you could do that in about an hour.
Neither could most of my colleagues. When I tell my colleagues, if you remember, I gave you a record of our surgery. I told you, take it
Yep.
to your friend and show it to him and tell him with this picture, tell him this surgery was done in 1 hour and 16 minutes. No neurosurgeon, no spine surgeon will believe you if they cannot understand what we are truly doing. It's the same way if you drive from Fargo to Twin City in 5 hours, and if you absolutely have no idea about flying, the concept of flying is foreign to you. You tell somebody you got from Fargo to Twin City in 1 hour, they say, what is going on? That doesn't exist. That's not true. But once you understand there is a different way, mode of transportation, you understand two things. Not only getting from Fargo to Twin City in 1 hour is possible, but it's actually safer. Mile for mile, flying is safer than driving. And here, if you don't know flying, if you don't know this minimal invasive technique, getting this done in 1 hour and 16 minutes is madness, craziness. But once you know it, you know it's possible, it's safe, and everybody can do that. Everybody can get in the airplane. It's not limited to certain few of people. And as much as I want to get whole credit for it, it is truly not Hamid Abbasi superior technique. It's a different mode of transportation, but what I can get credit for, I truly spend the time to learn it. And learning it is the point. And it's not an easy thing, but neither is flying, neither is any other thing that we do. Another thing that we lost in your surgery, 86 cc of blood.
How much is it? What's 86 cc's?
It is, a cup of coffee is 250 cc of coffee. So you lost a third of a cup of a coffee of blood. Yeah, let me show you how a gallon of fluid look like. This is a gallon of water.
Right.
This is how much I would lose blood in an open old-fashioned surgery for scoliosis. Two surgeon, 12-hour surgery, 10 to 12-hour surgery, and to achieve the same results. And while we would be prepared, we would transfuse, we would give platelets, we would do this, and so on. But just the thinking of that you can do this, and this has the same result like losing 86 cc of blood, is madness. In an open surgery, you cause so much damage to get in, and half of the time you're damaging the tissue, cooking the tissue to stop the bleeding, and you're losing blood. Now, this is a cup of coffee. In your surgery, we lost 1/3 of this, and in an open old-fashioned surgery, you easily can lose entire content of this. And this is how your spine, your disc look like. If there's an analogy, a disc is like a tire of a car that cushioned the car against the road. Your disc didn't have just a small flat. Your disc looked like this kind of, and you were still performing. That is the amazing part of that you still were performing while your disc looked like that. And by here, as you see, by the time you're 60 years old, if you have never had spine problem, you're among 5.7% of the population. And by the time you're 70 years old, there's 98% likelihood that you have. So this is a common problem.
That was one of the things I was going to tell you too, is that when I came back from the first appointment that I had with you and Alex, my partner used to do a lot of PI work or injury work, and I had shown him the scans, and he just said, oh my gosh. But I remember coming back and saying, you know what, a doctor finally explained this to me in a way I can understand, which is, you gave me the tire analogy when I was in your office. I remember looking at Ron and saying, that's the first time I really get it. We're saying that to Ron is, oh my gosh, my back's a tire and I finally get it.
Now, I want to show you a few slides here and tell you, this is open surgery on the left side, and this is what we did in your back. It's not about those little incision, because if you put those little incision together, you may have a long incision as well. But what happens underneath is what really makes you to recover within months rather than within years. And you told me that you were planning to take a year off after scoliosis surgery. That is probably even probably you may even need more. Many of my patients are told after scoliosis surgery, 1.5 to 2 years is when you can expect to be normal again. Now, a few days back, you sent me this picture, and that is the picture I was talking about. Made my day.
Oh, I look pretty terrible there, but
well,
I did email one of me cleaning stalls that I thought was pretty funny too, because I didn't ever think I'd get back in and be able to do anything like that.